Hello everyone and welcome to the clinical parasitology lecture. So in this video, we'll talk about the cestodes, or commonly known as tapeworms. So here is the overview of our discussion. So we're done with nematodes, or the roundworms. So we'll focus our attention to the phylum Platyhelminths, or flatworms. So here is the taxonomic classifications of metazoans. So just like we have discussed in the previous topics, metazoans are divided into two phyla. So we have phylum Nemathelminths, or the roundworms, and phylum Platyhelminths, or the flatworms. For this video, we'll talk about the class Cestoda, or what we call the cestodes. So your cestodes are divided into two classifications, namely your pseudophilidean and cyclophilidean. So later on, we'll discuss these two categories. So let's discuss our topic, the cestodes, or what we call the tapeworms. Here are all the specific parasites that we'll be discussing, which are classified into two categories, the pseudophilideans and cyclophilideans. Remember, although these are classified as cestodes, these are categorized into two separate categories due to the fact that they have different morphology and at the same time different life cycle. So let's talk about the morphological forms of cestodes or tapeworms. So just like nematodes, tapeworms also contains three morphological forms, namely your egg or ova, the larval stage, and lastly the adult worms. So let's talk about first the egg or ova of tapeworms. So for their eggs, these consist of hexecant embryo. So when we say embryo, this is the developing larva. So hexecant because the embryo contains 3 pairs of hooklets, or in total, we have 6 small hooklets arranged in pairs. So this hexecant embryo is protected by a thick layer of what we call embryophore. So this is the outer layer that protects the embryo. So in terms of the differentiation between pseudophilidean and cyclophilidean, for pseudophilidean, these are more oval in shape and are operculated. So later on, we'll discuss what do we mean by operculated. And in terms of ovoposition, pseudophilidean eggs are immature when laid. While for cyclophilidean, let me erase, okay? So for cyclophilidean, these are spherical and are non-operculated. And compared to pseudophilidean, these are matured or embryonated when laid. So here is an example of an operculated egg. So technically, when we say operculated, that means these are type of eggs that contains operculum. When we say operculum, this is a lid-like structure that usually opens once the developing larva is ready to go outside the shell. So usually this is only present on pseudophilidean eggs such as your Diphyllobothrium latum or D. latum and Spirometra species. Next form would be the larval stages. So one unique thing about cestodes or tapeworms is that they may contain multiple larval stages, specifically the pseudophilidean stages. So let's talk about first the cyclophilideans. So for cyclophilideans larva, these are all similar in terms of their morphology or in function, but they have multiple names or terms. So for cysticercoid larva, this is associated with the larval stage of Hymenolapis nana, Hymenolapis diminuta, and Dipylidium caninum. While for cysticercus larvae, this is common to Taenius species such as Taenia solium and Taenia saginata. And for hydatid cyst, this is for Echinococcus granulosus. While for pseudophilidean, they have a total of 3 larval stages, namely the choroecidium, procercoid, and plerocercoid or sparganum. So this is unique to D. latum or Diphyllobothrium latum and Spirometra. In terms of the appearance or the morphology, these are not described well in textbook due to the fact that these larvae develops within the host. Lastly, we have the adult worms. So adult tapeworms resemble a ribbon in appearance and range in length from several millimeters up to an impressive 15 to 20 meters. So to give you a visualization, 15 to 20 meters is the smallest Olympic size pool. So ganun kahaba yung pwede nilang ma-reach na length. And also, unlike your nematodes, cestodes or tapeworms are segmented. So that means these particular worms are divided into different portions or segments called your proglottids. So later on, we'll discuss the functions of these structures. Aside from that, cestodes or tapeworms also do not contain circulatory and digestive system. So these are very primitive worms in a way that instead of a mouth and anus, they absorb nutrients and excrete waste product through their tegument. Tegument is the outer surface covering of the worm. So just like here on this picture. And lastly, although this group of parasites possess or do not possess sophisticated systems such as digestive and circulatory, they usually have a complete reproductive system and are considered to be hermaphroditic. So that means one single worm is both a male and female. So that means they contains both the reproductive organs, ovaries, and testes. So now let's talk about the different structures involved in the morphology of adult tapeworms. So the first one is the anterior portion. So in the anterior portion of adult tapeworms, they contain what we call the scolex. So this is an anterior attachment organ. So from the word itself, attachment, so this is used by the adult tapeworms to attach themselves to the intestinal mucosa of their host. So normally there are two categories of scolex. So the first one, we have botryoid scolex. So this is described to be spindle-shaped, spatulate, or spoon-shaped in appearance, just like here on this picture. In terms of the attachment organ, they have two long sucking grooves. So example of this would be Diphyllobothrium latum and Spirometra. This is only unique to Pseudophilideans. Next one is acetabulate. So compared to your botryoid, acetabulate scolex are quadrate and cube-like, just like here on this picture. So their attachment organ or structure is what we call the muscular suckers, and are usually may range from 1 to 4 depending on the species involved. Also, they contain a structure called rostellium, and this is a part anteriorly positioned that contains hooks or spines. Again, not all cestode tapeworms contains hooks or spines, only a few that we'll be discussing later on. So for acetabulate, these are unique to Cyclophilideans, such as Taenia species, your Taenia solium and Taenia saginata. So the next structure is the neck. So this is the region of growth of the parasite. So this is where proglottids or segments are created. So in terms of the pathogenicity, as long as the neck and the scolex is attached to the intestinal mucosa, even without the presence of their body or the rest of their body, they can still cause infection and continue their life cycle because of their ability to regenerate. Next is the strobila. So the strobila is actually the collective term to describe the chains of segments called your proglottids. And in a body or in a structure of our tapeworms, they contain 3 types of segments or proglottids, namely your immature, mature, and the gravid proglottids. So just by looking at their words, their first word, we can know what are the types of sexual organs present on these type of segments. So for immature sexual organs are located. So these are your testes and ovaries. For mature, there is at least one set of fully matured organs. And for gravid, from the word gravid, that means this is the pregnant part of the parasite. So this is where eggs are actually located. So there are 2 ways on how cestodes release their eggs. So the first one, we have the apolytic proglottid. So this is only unique to Cyclophilideans. So except for Dilatum and Spirometra, all the parasites that involve here undergo apolysis. So this is a type of proglottid, specifically gravid proglottid, that detaches the body to release the eggs. Remember, gravid proglottid contains the eggs. So in order for them to release their species, they have to cut off or detach this part, your gravid proglottid. And this is unique to Cyclophilideans only. While an apolytic proglottid is unique to pseudophilideans such as dilatum and spirometra. So here, when we say anapolytic, that means in order for them to detach the gravid proglottid, they need to exhaust or release egg first. So this is the counterpart of apolytic. So for anapolytic, such as for pseudophilideans, after releasing eggs, the whole part or the whole gravid part is detached. So here is another representation of the anatomy of tapeworms. So again, we have the scolex or the attachment organ, the neck, which is the region of growth, and different proglottids or segments. So we have the immature proglottids, the mature proglottids, which contains developed organs or sexual organs, and the gravid proglottids, which contains the eggs. So here is the summary of the differentiation between pseudophilideans and cyclophilideans in terms of their anatomy or morphology. But also, please take note of the requirement of intermediate host. So unlike nematodes, all cestodes may require at least one intermediate host in their life cycle, with an exemption of pseudophilideans requiring two intermediate hosts. So let's talk about the cyclophilideans under class Cestoda. So the first cyclophilidean is Taenia solium. So Taenia solium is also known as the pork tapeworm because one of the mode of transmission for this parasite is through the ingestion of contaminated raw pork meat. So normally, adults are found in the upper small intestines of the definitive host, while larvae are found in the tissues of the intermediate host. So for the life cycle of this parasite, humans can be both the definitive and intermediate host. In terms of the cases, this is cosmopolitan in distribution. So that means the cases are seen worldwide, especially where pork meat is considered to be one of the staple food. Again, definitive and intermediate hosts can be both humans and pigs. And in terms of the pathology, there are two associated pathology. This is your taniasis and cysticercosis. Taniasis is an intestinal infection, usually involves the adult worms of the parasite, while cysticercosis is a tissue infection where larvae are more involved. So now let's talk about the eggs or ova of Taenia solium. So for Taenia species, the eggs are indistinguishable. So that means they have similar eggs. That's why it's not as important to diagnostically identify the parasite based solely on their eggs. So for the eggs and ova, this is 30 to 45 micrometers and it contains a thick and brown striated embryophore. So this is the outer covering of our eggs or ova. So this protects the hexicant embryo. So again, when we say hexicant embryo, this is an embryo or a developing larva that contains 3 pairs of hooklets. So again, this is indistinguishable to other Taenia species such as Taenia saginata. So here is a more realistic version or picture of Taenia solium ova. So in the first picture, as you can see, thick embryophore is very evident, but the hexicant larva is not visible. While on the second one, as you can see, the hexicant embryo is already developed, where 3 pairs of hooklets are visible. So again, larval stages of cestodes are not commonly described in the textbook. So now let's skip to the adult tapeworms. So again, for the adult, we take note of the presence of their scolex or the anterior attachment organ. So for the scolex of Taenia solium, it is quadrate, which is unique to all the cyclophilideans and contains 4 suckers or muscular suckers. So for the rostellium, since this is a cyclophilidean, it has a cushion-like rostellium with a double crown of 25 to 30 hooks, just like here on this picture. So here is a actual picture of the scolex for Taenia solium. So again, since this is a cyclophilideans, it contains acetabulate scolex, which means that it is cube-like or quadrate and contains 4 muscular suckers. So we have 1, 2, 3 at third at the back and 4th at the back portion as well. And again, it contains a rostellium, just like here on this picture, with 25 to 30 hooks in total. So now let's move on to the proglottids of Taeniosolium. So the general morphology of the proglottids usually resembles that of the other Taenia species such as Taenia saginata. But the only difference for Taeniosolium is that in their strobila, it contains 8,000 to 10,000 proglottids, and as well as in terms of their mature segment, it contains an ovarian lobe, an absence of vaginal sphincter, and a presence of 100 to 200 follicular testes. But the one that we use in order for us to differentiate Taeniosolium to other Taenia species is through their gravid segment. Remember, Cyclophilideans releases the gravid segment in order for them to release the eggs in stool. So the gravid proglottid, just like here on this picture, is detached to release the eggs. So for the gravid segment, we can view them under the microscope, where it contains 7 to 13 lateral branches that in other textbook is described as dendritic or finger-like. So in the lifespan of the parasite, they can release as much as 30,000 to 50,000 ova. So here is the Taeniosolium gravid proglottid, which is normally found in stool samples of infected person. Remember, again, this contains 7 to 13 lateral branches. So just like here on this picture. So these are finger-like or dendritic in appearance. So now let's move on to the life cycle of Taeniosolium. So for Taenia species, they all have similar life cycle. But the only difference for Taeniosolium is that it can be acquired in two ways. So there are two modes of transmission. So the first one, we have the ingestion of the infective larva, Cysticercus cellulosae. So this is acquired via ingestion of contaminated, undercooked, or raw pork meat. The next one is through the ingestion or direct ingestion of the eggs of Taeniosolium, especially through contaminated water or food. Again, the definitive host for this parasite is pigs and humans, and for the intermediate host, pigs and humans as well. So the infective stage of this parasite is the Cysticercus cellulosae or the infective larva. So this is usually the most common, but in other cases where eggs are ingested, eggs can be also the infective stage. While the diagnostic stage where we can use to differentiate the species is through their eggs and gravid proglottids. So here is the life cycle of Taeniosolium. So again, Taeniosolium is acquired via two ways. So the first one is through the ingestion of contaminated raw or undercooked pork meat. So this is also known as teniasis. So this is an intestinal infection where adults are seen in the small intestine of humans. So here in this life cycle for teniasis, humans act as the definitive host while pigs act as the intermediate host for this parasite. So this is initiated where eggs or gravid proglottids are ingested by our intermediate host, which is your pigs or swines. So these eggs will hatch and becomes the motile embryo, which is called your oncosphere. So your oncosphere will penetrate the intestinal wall of pigs and circulate to the muscles. So here, they will develop as Cysticercus cellulosae. So these are larval forms already, where these are acquired via ingestion, or these are acquired by humans via ingestion of meat, okay, or undercooked meat. So here, the Cysticercus larva will migrate to the small intestines of humans to become adults, and this cycle repeats once humans release or defecated the eggs and gravid proglottids. So that is your teniasis. Next one is through direct ingestion of eggs or gravid proglottids by humans. So here, this is also known as cysticercosis, and this is through the ingestion of eggs through contaminated water or food. Here in this life cycle for cysticercosis, humans act as the intermediate host of the parasite, which means that we only contains the larval forms of the parasite in our tissues. So just like pigs, when humans ingested the eggs or gravid proglottids, the oncosphere will hatch and penetrate the intestinal wall and migrate to the musculature of the infected intermediate host. In our tissues or muscles, the oncosphere will develop to become the Cysticercus cellulosae. So in this life cycle, this particular life cycle can be considered as a dead-end life cycle, since this can only be spread through direct ingestion of these larvae in the tissues. For the pathology of Taenia solium, we have two modes of transmission. That's why we also have two related diseases for this parasite. So the first one is taeniasis, and this is an intestinal infection due to the presence of adult worms in the small intestines of infected humans. So usually, humans infected with this parasite experiences mild and non-specific abdominal complaints. So for chronic cases, adult worms may also reside in the bile ducts of the liver, pancreatic ducts, or even in the appendix. Next one is cysticercosis. This is the organ or tissue infection where we harbor the larval stage instead. So here, Cysticercus cellulosae or the infective larva is seen in our tissues and organs, mainly our striated muscles in the brain, subcutaneous tissues of our eyes, heart, lungs, or even in peritoneum. But the most fatal one here is the dislodgement of the larva through the brain tissues, called your neurocysticercosis. So here is a picture of a brain scan of a healthy brain versus a brain with neurocysticercosis. So again, neurocysticercosis is a preventable parasitic infection caused by Taenia solium Cysticercus cellulosae. So here in this picture, the brain scan of patient infected with this parasite usually have enclosed sacs of larvae. So here, it causes multiple signs and symptoms such as seizures, and eventually, if the patient is not treated well for this parasite, that comes after. So for the diagnosis of Taenia solium, there are also two ways. So for taeniasis or the intestinal infection, the specimen of choice is stool, and this rests on the identifying characteristics of the proglottids, eggs, or scolex of the parasite. Again, for scolex, these are only seen in the stool sample of the patient once they are treated. So scolex or the presence of scolex in stool may indicate the proper or correct treatment of the infection. Next is cysticercosis or the organ or tissue infection. So basically, the specimen of choice here would be tissue or organ biopsy. So depending on what specific organ is or tissue is infected, where we can extract biopsy within that organ or tissue. CSF may also be acquired, especially in cases of neurocysticercosis, and this is only done through serological testing of that specific fluid. So for the treatment of Taenia solium infection, so we can administer praziquantel and niclosamide. So praziquantel works by causing severe spasms and paralysis of the worm's muscle, while niclosamide usually works by blocking the glucose uptake of the certain parasites. So in terms of other infections such as the organ and tissue infection, surgical removal can be one of the ways to treat the patient. For the prevention, so this is simple. This is through thorough cooking of meat or freezing of the meat at -20 degrees for 10 days to kill the infective larva inside the tissues of our meat. So the next Taenia species is Taenia saginata, and this is also known as the beef tapeworm. So the infective stage of this parasite is acquired by humans through ingestion of raw or undercooked cattle or beef meat. Adults of this parasite inhabits the upper jejunum of the definitive host. Example of this is human and cattle. while the larval stages inhabit the tissues of the intermediate host, and that would be the cattles. For the cases, this is similar to Taeniasolium, so this is cosmopolitan or wildly distributed. Again, for the definitive host, humans and cattles may harbor the adult forms of this parasite, while the intermediate host, only cattles may harbor the larval stages in their tissues. That's why, in terms of pathology, in humans, we only exhibit taeniasis or the intestinal infection. So now let's proceed to the morphological forms of Taenia saginata. So again, for Taenia species, they all have similar egg forms or ova forms. So this contains thick brown striated embryophore surrounding a hexecant embryo. So this is indistinguishable to Taenia solium. So in order for us to differentiate the two Taenia species, we can use the adult forms of this parasite. So this is where we can differentiate their scolex. For Taenia saginata, the scolex is cuboidal with a 1 to 2 millimeters in length. It also has 4 muscular suckers which are evident in the scolex, but the difference is that for Taenia saginata, it is devoid of rostellium and hooks. Here's an example of the scolex for Taenia saginata. So, muscular suckers are very evident on this picture. So, we have 4 muscular suckers surrounding the scolex, while rostellium is absent. Aside from the scolex, we can also differentiate Taenia saginata to Taenia solium through their strobila or the segments. So, for the strobila of Taenia saginata, it contains 1,000 to 4,000 proglottids, which is lesser than of the Taenia solium. In terms of the mature segment, for Taenia saginata, it is a square shape, which has more lobes of ovaries. So, it contains 2 large lobes of ovaries and a median club-shaped uterus. Aside from that, unlike Taenia solium, Taenia saginata contains a vagina with a sphincter. And it has more follicular testes than of Taenia solium, around 300 to 400. Aside from that, we can also differentiate Taenia saginata and Taenia solium through their gravid segment. For the gravid segment, the uterus contains 15 to 20 lateral branches, which is higher number than of the Taenia solium. And in other cases, this is described as dichotomous or tree-like. For the genital pores, it has an irregular alternation. And for a lifespan of Taenia saginata, it may release 97 to 124,000 ova. So here is an example of the gravid proglottid of Taenia solium. So it is tree-like and contains multiple branches, specifically 15 to 20 lateral branches. So for the life cycle of Taenia saginata, this parasite, specifically their infective stage, is only acquired through the ingestion of raw or undercooked beef meat. So the infective stage is what we call the Cysticercus bovis, which are encysted in the tissues of our intermediate hosts, such as cattle like cows and sheep. So the hosts or the definitive hosts of this parasite are cattle and humans, while the intermediate hosts are only cattle, where larvae are encysted in the tissues of these intermediate hosts. Again, the infective stage is what we call the Cysticercus bovis, and the diagnostic stage that can be acquired or seen in the stool would be eggs and gravid proglottids. So for the life cycle of Taenia saginata, this is similar to the taeniasis of Taenia solium. So this is acquired via the ingestion of the infective stage Cysticercus bovis. Since in the life cycle of Taenia saginata, humans act only as the definitive host but not the intermediate host, infection of this parasite is only related to the adult forms of the parasite, hence intestinal infection, or what we call taeniasis. So this is characterized by mild irritation at the site of the attachment, especially in the small intestine, or at chronic cases, obstruction of the intestines may manifest. So non-specific symptoms may include these following signs and symptoms. So the specific diagnosis of Tinea saginata rests on identifying the characteristics of the proglottids, specifically the gravid proglottids, the scolex, and occasionally eggs. So the specimen of choice is stool, since this is solely an intestinal infection. And according to Belisario, the first specimen usually brought in by the patient usually contains gravid proglottids, which are either passed down in the stool or may be seen or recovered in the patient's undergarments. So in order for us to differentiate the lateral branches in the gravid proglottids of Tinea saginata and Tinea solium, we can use the India ink preparation. So here, the gravid proglottids is pressed down or flattened in between two glass slides and stained with India ink. So the India ink stains the lateral branches as black, just like here on this picture. We can also use the formalin ether or ethyl acetate concentration techniques to increase the yield of eggs seen in this stool. For the treatment and prevention, the drug of choice is praziquantel, similar to Tinea solium, and the criteria for the cure include the following. So number 1, the scolex is recovered in the stool sample of the patient. Just like what we have discussed a while ago, the presence of scolex or multiple scolex in the stool connotes the positive treatment of the patient. Number 2, negative stools examination within in a span of 3 months after treatment should be observed. For the prevention, this is similar to the prevention of Tinea solium. So thorough cooking of meat and freezing the meat at negative 20 degrees for 10 days to kill the infective larva. So here is a comparison or summary of Tinea species in terms of their general info, life cycle, host, disease, and diagnosis. While for the morphology, here is a summary of the Tinea species. So the next Cyclophilidaean tapeworm is Hymenolapis nana. So this is also known as the dwarf tapeworm, and it's not what you think. This is not acquired via the ingestion of dwarfs, but rather because this is the smallest tapeworm of cestodes. So the adults of this parasite inhabits the small intestine, specifically the ileum part of the definitive host. So the cases usually are worldwide in distribution, but mainly affects children, especially children who fond of eating cereals and grains. Definitive hosts of these parasites are humans and rodents, and the intermediate hosts are also humans, rodents, and beetles. But unlike Tinea solium, Hymenolapis nana is the only human tapeworm which can complete its entire life cycle in a single host. That means both the larva and the adult worm are present in one single host. The pathology behind this parasite is what we call hymenolepiasis. So for the ova of Hymenolapis nana, since this is still considered a cyclophilidaean, it has an hexecant embryo which contains 3 pairs of hooklets. So these eggs may range at sizes of 30 to 47 micrometers, and these are spherical or subspherical in shape. In terms of the color, these are colorless or appear as clay-colored under the microscope. So in terms of the layers or membranes, it has 2 membranes. So the first one, we have the thin outer membrane or the embryophore, while the thicker outer membrane that protects the hexecant embryo contains bipolar thickenings, just like here on this picture. So connected on these bipolar thickenings are what we call the polar filaments, which may range at around 4 to 8. So here is a good example of the ova of Hymenolapis nana. So in this picture, the membranes are very evident. So we have the thin outer membrane or the embryophore and a thicker inner membrane that protects the hexecant embryo. So here is another picture of Hymenolapis nana ova. So as you can see here, the polar thickenings are evident on the oncosphere and the filaments as well. Next is the adult worm of Hymenopus nana. So for the adult worms of this parasite, the scolex is shaped as subglobular and contains 4 cup-shaped suckers similar to all cyclophilideans. For the rostellium, it has a retractable rostellium armed with single row of 20 to 30 Y-shaped hooklets. When we say retractable, that means it can withdraw or burrow deep inside the parasite. So here is a picture of Hymenopus nana adult worm. So on the left side of your screen, this is the whole adult worm for Hymenopus. Again, this is the dwarf tapeworm, so expect that this is the smallest or the shortest tapeworm. Okay, so zoom in on their scolex. We have a fork muscular cup-shaped sucker, which unfortunately only 2 are visible. So the 2 cup-shaped sucker are located at the back, and in terms of their rostellium, it has a retractable rostellium with 20 to 30 Y-shaped hooklets. For the strobila of Hymenopus nana's adult worm, it contains around 175 to 220 proglottids or segments. The mature segment is broader than long, and it contains 3 ovoid testes for every 1 ovary, while the gravid segment contains the eggs. Here is an example of the mature segment of the parasite. So ovaries and testes are located, and the genital pores as well. While on the other hand, this is the higher magnification of the gravid segment, where it contains the eggs of the parasite. The first one is the gravid segment, this one, and the magnified picture are the eggs. So now let's talk about the life cycle of Hymenopus nana. So humans may acquire this parasite in 2 ways. So the first one is the direct ingestion of the embryonated egg through contaminated water or food. This is also known as the direct infection, while the indirect infection is where cysticercoid larva is acquired through the ingestion of infected arthropods such as beetles. So this is also known as the indirect infection. For the definitive host, we have humans and rodents, and just like we have discussed a while ago, Hymenopus nana is the only tapeworm that can complete its life cycle in one single definitive host. That means in humans or rodents, adult worms and larval forms of this parasite may be seen in one single instance, while the intermediate hosts are usually rice and flower beetles. The infective stage, again, is embryonated egg and cysticercoid larvae, and the diagnostic stage is embryonated egg, which are passed down in the stool samples of patients. So there are 2 ways on how Hymenopus nana may develop within the host. So the first one is the direct life cycle. So in this life cycle, embryonated eggs are directly ingested by humans through contaminated food, water, or even fecal oral route through their hands. So embryonated eggs will be dislodged in the small intestine to become the cysticercoid larva. So these particular larvae will again develop as adults, and the scolex of these adults will attach themselves to the intestinal wall of our small intestine, specifically the ileum part. So upon maturing, the gravid proglottid will be released in the stool together with the eggs, and the cycle continues once these embryonated eggs are ingested by another suspected human host. Remember also that in terms of the life cycle for Hymenopus nana, autoinfection may be possible due to the fact that we are both the definitive and intermediate hosts. So eggs may hatch within the intestine to become another cysticercoid larva and as well as to become adults. Next one is the indirect life cycle. So the development of the embryonated egg to the cysticercoid larva happens inside the arthropod vector, the arthropod intermediate host. So this develops to become the cysticercoid larva, and this is acquired by humans by ingestion of the arthropods, such as the rice and flower beetles. And the cycle repeats where the the cysticercoid larva develops as an adult inside the intestine. So for the pathology of Hymenolapis nina, this is also known as hymenolapiasis, and usually symptoms are generally produced because of the patient's immunological response to the parasite. So in light worm burden, this is generally asymptomatic, so patient may not develop any signs and symptoms, but comes moderate to chronic cases, these types of signs and symptoms may be manifested. At heavy infections, enteritis is possible, or the inflammation of our intestine. This is due to the necrosis and desquamation of the intestinal epithelial cells that surrounds our intestine. So for the diagnosis of Hymenolapis nina, this is made by the demonstration of their embryonated eggs in patient's stool sample. In lighter infections, we can use concentration techniques to increase the yield of these diagnostic stages. Remember that the proglottids of this parasite are not recovered because they undergo degeneration prior to passage with the stool. For the treatment, the drug of choice is praziquantel, and this causes vacuolization and disruption of the outer layer or the tegument in the neck region of the adult worm. For the epidemiology, here are all the countries involved in the cases of Hymenolapis nina infection. So there are 20 million cases worldwide recorded, and the prevention for this parasite is through personal hygiene and environmental sanitation, and rodent control must be observed. So the next parasite is Hymenolapis diminuta. So this is a parasite primarily affecting rats, hence the common name rat tapeworm. So the adults of this parasite resides in the small intestines of rats, and in terms of human cases, these are only incidental or accidental. So we harbor the adult stage of this parasite through ingestion of contaminated or infected arthropods. So the definitive hosts are rats, but humans can also get infected by ingestion of certain arthropods or the intermediate hosts such as fleas, beetle, cockroaches, mealworms, or earwigs. So human cases are related to hymenolapiasis. Before we go through the pathology of the Hymenolapis diminuta, let's talk about first the difference of their ova through the similar species Hymenolapis nina. For Hymenolapis diminuta, the eggs and ova are larger at around 60 to 80 micrometers and are circular and bile stained in color. The oncosphere or the specific embryo has a inner membrane with bipolar thickenings, but remember this, it has no bipolar filaments compared to H. nana. So here is an example of an ova for Hymenolapis diminuta. So it's very similar to Hymenolapis nina, but again, the embryo does not have polar filaments. Another picture where hexacant embryo is more evident. So we have at least 2 to 3 pairs of hooklets on the embryo. So now let's talk about the adult worm for Hymenolapis diminuta. So for the adult worms, their scolex is shaped as a knob, and it has 4 acetabulum or suckers, similar to all cyclophilideans. So the rostelium of this parasite is unarmed and rudimentary, just like here on this picture. So that means when we say unarmed, rudimentary, that means the rostelium is pointy, and at the same time, it does not contain any hooks or hooklets. So here's an example of a Hymenolapis diminuta scolex. So again, muscular suckers are evident in this picture with no hooks or spines. Now let's move on to the strobila of Hymenolapis diminuta. For the strobila, in terms of their mature segment, this is similar to Hymenolapis nina. It is broader than long, and it contains 3 ovoid testes for every 1 ovary. The gravid segment of this is also filled with eggs, similar to H. nana. So remember, the only difference in terms of the proglottids for H. diminuta is that for H. nana, for H. diminuta, these are larger in size. So this is a mature segment of H. diminuta. So testes are very evident on this part, and ovaries on the middle, another testes, and the uterine pores that are connected to the outer covering of our parasite. For the life cycle of Hymenolapis diminuta, the only difference between this parasite to H. nana is that they only have one mode of transmission, and that would be the ingestion of the infective stage cysticercoid larvae through infected arthropods. So there are no recorded cases where direct ingestion of embryonated eggs for this parasite. For the host, again, the definitive host of this parasite are rats, while humans becomes accidental definitive hosts as well. Intermediate hosts may include the following. For the infective stage, this is cysticercoid larva, and the diagnostic stage are embryonated eggs seen in stool. So here is the simple life cycle of Hymenolapis diminuta. So eggs are passed down in the feces of the infected definitive host, such as rats or humans. So these eggs are ingested by an arthropod intermediate host. Example of this would be rat fleas and beetles. So these eggs will release the motile embryo called your oncosphere and will penetrate the intestinal wall of the arthropod. So inside the arthropod, where development of larva will take place. So from an oncosphere, it will develop to become the cysticercoid larva inside the specific intermediate host. So this larva is ingested through the infected arthropod by our definitive hosts such as rats and humans. So inside the host, specifically the small intestine, where development of the cysticercoid larva to adults take place. So adults will mature and will penetrate the intestinal wall through their scolex. So once the gravid proglottids release eggs, the cycle continues once the particular eggs are ingested by another arthropod. So for the pathology of this parasite, normal healthy people usually manifest asymptomatic infections, and the highest number of recorded worm is 19. So clinical manifestation at later stages or chronic stages are minimal and non-specific and usually resolves on its own. So one good reason why Hymenolapis diminuta is not pathogenic in nature is that the lifespan of H. diminuta in humans is short, which is why the human infection are usually at light stages only. For the diagnosis, the specimen of choice is stool, and our diagnostic stages are embryonated eggs, which are seen in stool. Scolex may be recovered, especially if treatment is needed. So, in terms of the differentiation between H. diminuta and H. nana, H. diminuta ova are circular, larger in size, and has no bipolar filaments. The methods that we can use is direct fecal smear, or possible at lighter infections, we can use concentration techniques. The treatment is similar to other cestode infections, so praziquantel. For the epidemiology, this occurs usually through the ingestion of grain beetles infesting dried grains, dried fruits, flour, and cereals. So this is more common in children because children are the most commonly demographics that eat cereals in specific. Prevention is similar to H. nana, so rodent and arthropod control and personal hygiene as well. So here is a side-by-side differentiation between the two Hymenolapis species. We have Hymenolapis nana and Hymenolapis diminuta. Another differentiation in terms of the morphology between the two Hymenolapis species. So the next Cyclophilidaean tapeworm is Dipylidium caninum. So Dipylidium caninum is a very common intestinal parasite of dogs and cats worldwide, especially in dog population where ectoparasitism is high. Hence the common name dog tapeworm and double-pored tapeworm. So in humans, the Dicaninum infection is accidental and is observed to be more common in children than in adults. So, the adults of this parasite inhabit the small intestines of the definitive host, such as cats, dogs, and accidentally humans. So the cases are cosmopolitan as well, where dogs and cats are prevalent since these are domesticated animals. Definitive, again, is dog and cats, and the intermediate hosts of this parasite are fleas, such as cat flea, dog flea, and human flea. The pathology behind this parasite is what we call the dipilidiasis, so the accidental parasitism in humans. So now let's move on to the morphological stages of this parasite. So for Dipylidium caninum ova, these are spherical and thin-shelled with hexecant embryo. Since this is still a cyclophilidean tapeworm, hexecant embryo with 3 pairs of hooklets are evident. But what is unique to this parasite ova is that it comes in capsule. So as you can see on this picture, usually the capsules may contain 5 to 30 eggs in total. So here is a more realistic picture of the egg capsule for Dipylidium caninum. For the adult worm of D. caninum, the scolex is small and globular, and it has 4 deeply cup-shaped suckers, similar to all our cyclophilideans. So in terms of their rostellium, it is protrusible. So when we say protrusible, that means in Tagalog, patusok. So it is pointy, armed with 1 to 7 rows of rose-thorn shaped hooklets. So here is another picture of the scolex for D. caninum adult worm. So the protrusible rostellium is evident in this particular picture with 1 to 7 rows of rose-thorn hooklets. So now let's talk about the segments for Dipylidium caninum adult worm. So for the mature segment, it contains 2 sets of male and female reproductive organs and also contains 1 pair of bilateral genital pores. So hence the common name double-pored tapeworm. So later on, we'll show you the location of these 2 genital pores in the mature segment. While for the gravid segment, it resembles a pumpkin seed. So the gravid segment contains capsules filled with 8 to 15 eggs enclosed in an embryonic membrane. So here is the mature proglottid where bilateral genital pores are located, with 2 ovaries present on this area. So next one is the gravid segment. So this whole segment here is the gravid segment filled with egg capsule. So macroscopically, the eggs appears to be pumpkin seeds. So in a magnified version, the capsules and the eggs are present. So now let's talk about the life cycle of Dipylidium caninum. So for the life cycle, this is acquired via the ingestion of the cysticercoid larva through infected arthropods. So here are all the arthropods involved in the life cycle of this parasite. So these arthropods also act as the intermediate host for this parasite. So the infective stage of this parasite is cysticercoid larva, and the diagnostic stage can be eggs and proglottids as well. So here is a representation of the life cycle of Dipylidium caninum. So again, Dipylidium caninum is a zoonotic parasite. That's why in humans, the life cycle is very quick. So this starts off with gravid proglottids are passed down in the feces, or usually sometimes emerge from perianal region of infected animal or human host. So the proglottids will disintegrate and release the egg packets, which are then picked up by our arthropods such as cat flea, dog flea, or human flea. So inside the flea, where oncosphere, the motile embryo, will develop to become the cysticercoid larva. So the cysticercoid larva will remain until the flea or the intermediate host matures. So this particular larva is then ingested once humans or definitive host dogs and cats ingested the arthropod. So inside the definitive host in humans, this cysticercoid larva will mature to become adults, and adults will attach themselves to the intestinal mucosa. So this eventually mature and release gravid proglottids in the feces, and the cycle continues once the egg packets are released in the stool. So for the pathology of the parasite, Dipylidium caninum, this is also known as dipylidiasis. So normally at lighter infections, infection is rarely heavy and symptoms are minimal. In chronic cases, slight intestinal discomfort may be felt by the patient, as well as epigastric pain, diarrhea, pruritus, and allergic reactions. While most patients are asymptomatic, moderate eosinophilia also have been reported. For the diagnosis, the specimen of choice is stool, and the gravid proglottid can be examined macroscopically for the presence of capsules. So these may appear as melon seeds, pumpkin seeds, cucumber seeds for moist sample, or even rice grains. Treatment for this parasite is praziquantel 12 as well. For the epidemiology, human infection is rare since this is a zoonotic parasite, but cases have been reported in European countries, USA, Argentina, Rhodesia, China, and also here in the Philippines. So the most commonly affected demographic are infants and very young children that are usually infected because of their close contact with their pet cats and dogs. So likely the transmission could have occurred through hand-to-mouth contamination or accidental swallowing of arthropods when hugging or kissing their pet animals like dogs and cats. So normally parents also may observe the motile proglottid in children's feces or underwear. Adults are not commonly affected since we as an adults have more developed immune system. For the prevention, the periodic deworming of pet cats and dogs should be followed, and also health education of children. So the next group of parasite is what we call the Echinococcus species, and these are also known as the hydatid tapeworm. So these are regarded as emerging zoonotic parasite, where this is caused by the larval stage of an Echinococcus species called the hydatid cyst. So this cyst, specifically the larval stage, inhabits the tissues of the infected host such as the liver, lung, and brain, while the adults can be found in the small intestines of definitive hosts such as canines and humans. So species may include all of these, but Echinococcus granulosus is the most common parasite under Echinococcus species. In terms of the ova for Echinococcus granulosus, the eggs and ova for this parasite is similar to Taenius species, which have thick brown striated embryophore and a hexecant embryo. So the next one is the larval form for Echinococcus granulosus. So this is also known as the hydatid cyst, and it's actually the diagnostic stage of the parasite. So here we require tissue or organ biopsy to highlight or identify the specific stage. So the cyst is around 1 to 7 centimeters in diameter. So in this slide, you can see a cross-sectional picture of the cyst for Echinococcus granulosus. So this is stained with hematoxylin and eosin, and it highlighted the different structures within the cyst. So highlighted as A is the host tissue or the infected tissue, which encapsulate the hydatid cyst wall. So the hydatid cyst wall is comprised with two layers. The first layer is an acellular lamellated layer labeled as B. And the second layer is a nucleated germinal layer labeled as C, from which the brood capsule labeled as D arises. So the brood capsule is actually the covering which protects the protoscolysis, or what we call the developing larva. So sometimes protoscolysis may not contain brood capsules and they are freely around the host tissue, called the hydatid sand. So the next one is the adult worm for Echinococcus granulosus. So the adult worm inhabits the small intestines of canines. So it measures at around 3 to 6 millimeters in length and possesses a pyriform scolex, which is somehow reddish and globular. So just like the other Cyclophilideans, they contains 4 acetabulum or 4 cup-shaped suckers, and the rostellium of this parasite is armed with 30 to 36 hooklets. While on the strobila, it contains only 3 proglottids, namely the immature, mature, and the gravid. By the way, for the gravid segment, this is by far the widest and longest among all the segments for this adult worm, just like here on this picture. So the gravid segment has, especially their uterus, have lateral invaginations filled with eggs. So for the life cycle of Echinococcus species, this is acquired via the ingestion of the infective embryonated eggs, which is in humans accidental through fecal contamination. So the host of this parasite are the canines or definitive hosts, while the intermediate hosts may be goats, horses, camels, and sheep. In humans, we are considered to be accidental intermediate hosts as well, where we harbor the larval stage of the parasite in our tissues. So the infective stage is embryonated egg, while the diagnostic stage of this parasite are hydatid cysts and eggs. So for the life cycle of Echinococcus species in humans, it starts off when embryonated eggs are accidentally ingested by humans through fecal contamination. So embryonated eggs will then migrate down to the small intestine to release the motile larva or the motile embryo called the oncospheres. So these oncospheres will then penetrate the mesenteric venules of our blood vessels to enter the circulation. So within the circulation, it will attack different organs of our body, mainly the brain and the lungs. So within the tissues of these organs, where the oncosphere will develop to become the hydatid cyst. So remember, in the life cycle of Echinococcus, humans only act as the intermediate host, where we harbor the larval stage. Another thing to remember is that in the life cycle of Echinococcus, humans are also considered to be a dead-end host of the parasite, since we cannot transfer the larval stage of this parasite to other humans unless cannibalism is evident. But in the zoonotic life cycle, this may be passed down from an intermediate host to a definitive host through cannibalism. So similar life cycle happens on the intermediate host. So for the pathology of Echinococcus granulosus, this is also known as the human cystic echinococcosis. So this is caused by the developing larval cysts in the tissues of humans, called the unilocular hydatid cysts. So the most common and most important site of involvement is usually the liver, which counts for about 70% of the cases, while lungs counts for 20 to 30%, and other organs such as brain and eyes counts for 10% of the cases. So human cystic echinococcosis may manifest as inflammatory reactions within the tissue of within the infected tissue. So there will be inflammation and redness within the tissue, and in chronic cases, organ impairment may happen where tissue necrosis and atrophy is possible. For the diagnosis of Echinococcus species, the best method to use here is through tissue biopsy, where we can visualize and identify the presence of hydatid cysts. Other methods that we can also use is through radiography and serological testing. Treatment is through albendazole or administration of albendazole, but in cases of more than 10 centimeters cyst, surgical resection may be needed. So other methods that we can use is bentonite flocculation test, and this is done by adding specific samples in a solution. So a portion of the sample is mixed with a solution containing bentonite, which act as the flocculating agent. So the mixture is allowed to stand or incubate for a specified period, during which the bentonite facilitates the settling of any suspended particles or parasites present in the sample. In some cases, variations such as centrifugation may be used to enhance the sedimentation process, helping to concentrate any parasite or particular matter at the bottom of the test tube. So examination is done where clarity or turbidity of the supernatant is observed. So if parasites are present in the sample, they may settle along with other particles, forming a visible pellet or sediment at the bottom of the test tube. So the clarity of the supernatant may also be assessed visually or with the aid of specialized equipment. So another immunological test for Echinococcus species is the Cassoni intradermal test. So this is usually similar to all skin tests under parasitology, where the injection of a live larval antigen is done in the skin or to the skin of the patient. So a presence of a large wheal of at least 2 to 4 centimeters is considered to be a positive result. This happens when the patient had already been infected or previously infected by the parasite, causing the host or the patient to produce antibodies. So if we inject another live antigen to the skin of the patient, this interacts with the antibodies, causing inflammation or allergic reaction. For the epidemiology, this parasite contributes to around 2 to 3 million cases of parasitic infections worldwide, and here are all the countries involved where cases are more increased. So prevention of this parasite is through regular testing and quarantine and treatment of dogs with praziquantel. So here is the summary or a side-by-side differentiation between the two cyclophilidaean parasite that parasitizes dogs or canines. So the next one is Rhyletina garrisoni, and this is a cyclophilidaean tapeworm that was included in the book of Medical Parasitology in the Philippines by Dr. Belisario. So this is actually a common tapeworm of rodents, and the habitat of these parasites, specifically their adults, are in the intestines of the definitive host. So in the Philippines, 20 human infections were recorded, where the first reported infection was actually in an adult Filipino in 1911. So the definitive hosts of this parasite are rodents, while the intermediate hosts are flower beetles under the genus of Tribolium confusum. So this is actually the mode of transmission where humans get infected by ingesting or accidentally ingesting these types of arthropods called the flower beetle. So the pathology in humans are asymptomatic and children are more affected. So for the ova of this parasite, these are spindle-shaped and the embryo is enclosed in two thin membranes. So we have the outer elongated membrane and the inner spherical membrane. Now for the adult worm of this parasite, the scolex is minute or small and subglobular. It also contains 4 acetabulum similar to all cyclophilidaean parasites. The rostellium is armed with 2 alternating circular rows of 90 to 140 hammer-shaped hooklets. For the strobila of this parasite, the mature segment has a bilobe ovary surrounded by 36 to 50 ovoid testes, while the gravid segment is similar to Dipylidium caninum, which has 200 to 400 egg capsule. So within those egg capsule, 1 to 4 spindle-shaped eggs are present. And there are cases, according to Belisario, that this particular segment is motile that appears to be a white rice grain in appearance. For the life cycle of this parasite, this is acquired via the ingestion of the cysticercoid larva through infected insects such as flower beetle. The hosts of this parasite are rodents, which act as the natural definitive host, while human act as the accidental definitive host. While the intermediate hosts, where these particular hosts harbor the larval stage, are the flower beetles. Again, the infective stage is the cysticercoid larvae, and the diagnostic stage is the embryonated egg and proglottids. So here is the visual representation of the life cycle for Rhyletina species. So this starts off when proglottids containing egg capsules are passed down in the feces by an infected definitive host. So this egg capsule will be ingested by the suspected intermediate hosts such as ants or beetles. So within those arthropods where the motile embryo called your oncospheres will develop to become the infective larval stage called the cysticercoid larva. So the definitive hosts such as rats and humans will be infected by this larva through ingestion of the arthropods. So within the definitive host, the cysticercoid larva will develop in their intestines, specifically in the small intestine, to become adults. Adults will attach themselves through their scolex in the intestinal wall, and the cycle continues once the gravid proglottid is released in the feces of an infected definitive host. For the pathology, patients infected with this parasite appears to be healthy and asymptomatic. Children which have increased cases of this infection may be brought for medical consultation when proglottids are passed out with their feces. Diagnosis of this parasite is through the usage of stool, where we can highlight the embryonated eggs and proglottids. The methods that we can use is the conventional direct fecal smear, or we can also use the concentration techniques, especially at lighter infections. Treatment is similar to all other Cyclophilidae and tapeworms, and that would be the praziquantel. For the epidemiology, 20 local cases are recorded here in the Philippines, where the most affected demographic are children below 3 years old. There are also recorded cases in other parts of the world such as Thailand, Tokyo, Australia, Ecuador, and North Iran. The prevention for this parasite is through the proper storage of grain products or flour products and sanitary waste disposal of human feces. Rodent control may also help in prevention or preventing this parasite. So now let's move on to the order Pseudophilidae. Again, to give you a recap, so Pseudophilidae tapeworms include Diphyllobothrium latum and Spirometres species. Again, here is the difference between Pseudophilidae and Cyclophilidae tapeworms. For the Pseudophilidae, their scolex is spoon-shaped or spatulate with botria. So instead of cup suckers, they contain sucking grooves with no rostellium nor hooklets. Aside from that, their strobila, specifically their gravid segment, releases eggs and then detaches the particular gravid segment, called anapolytic. While their ova are oval, operculated, and immature when laid, and in terms of their larval stages, they contain 3 larval stages in total. So we have the coracidium, the procercoid, and plerocercoid, which by the way develops in sequence. Plerocercoids is the infective stage of the Pseudophilidae tapeworm. Aside from that, the intermediate host requires 2, and that would be the first intermediate host are the copepods, while the second intermediate host may be marine animals such as freshwater fish, frogs, or snakes. So now let's talk about Diphyllobothrium latum. So this parasite belongs to the order Pseudophilidae, and it is one of the 13 species of Diphyllobothrium that infects human. It is commonly called the fish tapeworm or the broad tapeworm because the intermediate hosts of this parasite are fishes. So the habitat of these parasites, specifically their adults, is the small intestines of the definitive host such as humans. While in terms of the intermediate host requirement, they require 2. The first one are the copepods and the second are the freshwater fish. So the pathology behind this parasite is what we call diphyllobothriasis, and this refers to the intestinal infection with the adult worm. For the Diphyllobothrium ova, these are yellowish-brown with moderately thick shell. They also have inconspicuous operculum. Again, this is unique to the Pseudophilidae eggs, where there is a presence of a lid-like structure at the anterior portion of the egg. When we say inconspicuous, that means these are not clearly visible. Opposite to the operculum is the small knob-like thickening called the abopercular knob. This has no function, but this can be seen as well for the latum ova. Aside from that, the undeveloped embryo may be seen called the coracidium. So this is the first stage or the larval stage of the parasite. So here is a picture of the latum ova. So here in this picture, the operculum are very visible, which opens up once the egg is released in the water. While the abopercular knob, I don't know if you can see it, at the posterior end of the parasite, or the egg rather. So the development of Pseudophilidae ova take place in the water. So this particular ova will release the free-swimming ciliated embryo called the coracidium, which in turn is ingested by the first intermediate host called the cyclops. So inside the cyclops, coracidium will develop to become the procercoid, and this particular larval stage contains the attachment organ called the cercomer. So this attachment organ contains 3 hooklets. So the cycle will continue once the procercoid inside the cyclops is ingested by a marine animal, usually a freshwater fish. So inside the freshwater fish, this will develop to become the plerocercoid or the sparganum. So according to Belisario, this type of larval stage are glistening, opaque white, and unsegmented. So now let's talk about the adult worm for Diphyllobothrium latum. So the scolex of this parasite is around 2 to 3 by 1 millimeter in size, and the shape is spatulate or spoon shape. It also contains 2 sucking grooves, just like here on this picture. Also, unlike cyclophilideans, pseudophilidean tapeworms do not contain rostellium. So here is the scolex of Diphyllobothrium latum adult worm. So again, this contains sucking grooves at the anterior and posterior portion of the parasite. So for the strobila of the adult worm for Diphyllobothrium latum, it contains around 4,000 proglottids in total. The mature segment has 1 set of reproductive organs, while the gravid segment has a uterus that is appeared to be dark, rosette-like, and coiled. So here is a side-by-side comparison of the mature segment and the gravid segment of the adult worm for Diphyllobothrium latum. So on figure A, the presence of the rosette-shaped ovaries are evident. So when we say rosette shape, that means they appear to be bouquet of flowers, while on figure B, the gravid segment contains a rosette-shaped coiled uterus at the middle of the proglottid. So take note also the lack of eggs within the proglottid, since pseudophilidean tapeworms are anapolytic. So that means they release egg first in the stool, and then the particular proglottid is detached to the worm. So for the life cycle of Diphyllobothrium latum, this is acquired via the ingestion of the plerocercoid larvae through the tissues of undercooked fish such as perch, trout, salmon, and pike. So the host of this parasite, in terms of definitive, we have humans and fish-eating animals, while the parasite requires 2 intermediate hosts. The first one, we have the copepods, and the second one are freshwater fish. The infective stage of the parasite to humans is what we call the plerocercoid larva, while the diagnostic stage may be operculated eggs and proglottids seen in stool. So the life cycle of Diphyllobothrium latum starts off when unembryonated eggs are passed in feces by the infected definitive host, such as humans and fish-eating animals. So these eggs will embryonate in water to release the motile embryo called the coracidia. So the coracidia will then be ingested by our first intermediate host, such as cyclops and copepods. So inside the infected crustacean, where the coracidia will develop to become the procercoid larva. So these cyclops will then be ingested by our second intermediate host, such as small and large fishes. So inside the second intermediate host, where procercoid larva will develop to become the infective plerocercoid larva. So this larva will be infective once our definitive hosts, such as humans and fish-eating animals, will ingest the second intermediate host, fishes. So inside the definitive host, the plerocercoid larva will then develop to become adults. So here, they will attach their scolex to the intestinal wall and mature and release the gravid proglottids in stool sample. So the cycle continues once these unembryonated eggs are released again in water. For the pathology of Diphyllobothrium latum, this is also known as diphyllobothriasis, and infections are usually limited to one worm, although there have been reports of mechanical obstruction due to a large number of worms in the intestine. Infected individuals may show no signs of disease, especially at early stages of the infection. Some, however, may experience nervous disturbances such as digestive disorders, abdominal discomfort, weight loss, weakness, and even anemia. So later on, we'll discuss what type of anemia is being produced during the latum infection. So the signs and symptoms felt by the patient during the infection is due to the allergic reactions to the toxins or byproducts of the generating proglottids inside the intestinal mucosa. The other possible reason is due to the mucosal irritation of the scolex of our adult worm. At chronic stages, the particular infection may lead to hyperchromic megaloblastic anemia. So this is a type of anemia where red blood cells appear to be bigger and have no central pallor, just like here on this particular blood work. So what happens in megaloblastic hyperchromic anemia is that the particular parasite competes with the vitamin B12 present in our diet. So just to give you a brief background about vitamin B12, this is a vitamin that is needed to form red blood cells and the synthesis of DNA. So without this vitamin, our bone marrow produces abnormal red blood cells which are bigger and have no central pallor, just like here on this picture. Thrombocytopenia or increase in platelets are also recorded since the bone marrow is not functioning well due to the lack of vitamin B12, and leukopenia or increase in white blood cells, specifically eosinophils, since this is a parasitic infection. So this is a similar case to vitamin B12 deficiency. For the diagnosis of Diphyllobothrium latum, the specimen of choice is stool, where we can identify operculated eggs or occasionally proglottids of this parasite. We can use the conventional direct fecal smear and the cat-to-cats method. Other methods we can use is the examination of the gastric juice, because Diphyllobothrium latum infection and pernicious anemia have similar blood work. So here they produces hyperchromic megaloblastic anemia. So the red blood cells are similar in terms of the morphology for these two infections. So in order for us to differentiate them and not to confuse them, we can extract the gastric juice. For the latum, they have increased free hydrochloric acid, while for pernicious anemia, they have decreased gastric juice or gastric HCl called aclohydria. For the treatment and prevention, the drug of choice is praziquantel, and the criterion for cure is recovery of the scolex in feces after treatment. So if the scolex is not recovered, a repeat stool examination should be done after 3 months to be certain that the patient is no longer infected. For the prevention, the proper cooking of fish should be followed, and freezing for 24 to 48 hours at a temperature of negative 18 degrees Celsius. So the preference for eating raw fish and the lack of sanitary toilet facilities contribute to the transmission of the latum parasite. Although other mammalians such as dogs, cats, and bears exist as reservoir hosts or extra definitive hosts, man is the most responsible for the propagation of the infection in endemic areas. So the latum is prevalent in temperate zones where population has a habit of eating raw or improperly cooked fish. So in the Philippines, 7 human infections have been documented. And finally, the last species under Pseudophilidaean is Spirometra species. There are a lot of Spirometra species in nature, but only these 3 are common to cause human infections. So we have Spirometra mansoni, Spirometra erinaceae, and Spirometra ranarum. So these particular parasites inhabit the tissues of the infected human host. So here, we act as the intermediate host of the parasite since we harbor the larval stage. So this is a zoonotic disease where the definitive hosts are considered to be cat, dogs, and other carnivores. So the disease is called sparganosis, connoting the larval infection with the plerosorcoid or sparganum. So for the morphology of this species, unfortunately, there are little to no information about these particular parasites. So the eggs and ova of this parasite are operculated similar to the latum but are smaller in size. For the sparganum or the plerosorcoid larva, the infective stage, the anterior end is thickened and wrinkled just like here on this picture, and there is a characteristic of a cleft-like invagination at the anterior portion of the scolex of the worm. The gravid proglottid contains a spiral uterus. For the life cycle, the first intermediate hosts are considered to be the copepods, where they acquire the free-living embryo called the coracidia in water. So the coracidia will develop inside the copepods as procercoid larvae, while the second intermediate host may be frogs, snakes, or chicken. While the definitive hosts are dogs and cats, humans can be accidental, where we can acquire the parasite through first ingestion of the procercoid larva through drinking contaminated water. So here we can acquire the copepods directly, while the second one is through the ingestion of plerocercoid or sparganum larva in infected frog, snakes, and chicken. So here is the visual representation of the life cycle for Spirometra species. So this starts off when unembryonated eggs are passed in the feces by their infective definitive hosts such as cats and dogs. So these embryonated eggs will embryonate and develop in water to release the free-swimming larva called the coracidia. So the coracidia will then be ingested by our first intermediate host such as copepods. So inside the copepods where procercoid will develop, and once ingested by our second intermediate host such as fish, frogs, and chicken, will develop to become the plerocercoid larva. So this is the infective stage of the parasite. Humans may acquire these larvae in two ways. So the first one is through drinking contaminated water, where we can harbor the procercoid larva, or next is through eating undercooked or raw chicken, frog, or fish meat, where we can harbor the plerocercoid larva. So in humans, there is no development of adults, so the particular larva will inhabit the tissues of our body. So for the pathology of the parasite, this is also known as sparganosis, describing the presence of the plerocercoid larva or sparganum in the tissues of the infected individual. So the larva may be found in any part of the body, but most commonly found in the eyes, in the subcutaneous and muscular tissues of the thorax, abdomen, thighs, inguinal region, and in the visceral organs of our body, such as brain, lungs, and spleen. So patients may complain of painful edema. This is due to the constant migration of the larva through the tissues, hence the other name, migrating tumor. So local indurations may also be possible, and periodic giant urticaria, just like here on this picture. So since there is allergic reactions of our body due to the presence of worms in the tissues, edema and erythema with chills, fever, and high eosinophilia are also recorded. For the diagnosis, the specimen of choice for this parasite is tissue biopsy, where we can highlight or describe the presence of the sparganum larva. Again, the sparganum larva may appear as an adult with a cleft-like invagination and a wrinkled anterior portion. So the treatment for this parasite is surgical removal of larvae from the infected tissues. Praziquantel may also be administered, especially at early stages of the infection. So for the epidemiology, here are all the countries involved in the cases for sparganosis. According to other sources, sparganosis is mostly acquired through drinking contaminated water. So in order for us to prevent this parasitic infection, filtration and boiling of water should be followed, proper cooking of food, especially fishes and marine animals as well, and avoiding the practice of applying the flesh of frogs to inflamed areas. Normally kasi, this is what we call the poultices. Okay, this is applying fresh tilapia skin to the inflamed, burnt areas to increase the collagen production. So this practice should be avoided, especially at water areas where infection of sparganosis is prevalent. So that ends our lecture for Cestodes. Here are all the references. Thank you and good day.